right, guys, sorry about the delay. We'll go ahead and get started. I'd like to welcome you, Dr. Jennifer Grove, pediatrician at Blank Children's Pediatric Clinic, and I'll turn it over to her. Welcome.
Thank you so much. If you have any problems hearing or having any technical difficulties, please type into the chat box and we'll hopefully be monitoring that. But today I'd like to talk to you a little bit about early childhood obesity prevention in the population from age 0 or prenatal to 2 years of age. The AAP National has a new initiative from the Institute for Healthy Childhood Weight on building a foundation for healthy living. And so how do we merge these two topics to really help our youngest Iowans? So I'm a pediatrician at the Pediatric Clinic here in Des Moines, Iowa. I've been here for about 15 years. I'm also active at the Iowa chapter of the American Council of Pediatrics as the chair of the Committee on Obesity, and I've had the opportunity to be engaged in national work at the AAP as a coach member of the section on obesity, as well as a board member here at the Iowa Medical Society. So our objectives today are to be familiar with the trends in excess weight gain in early childhood, as well as to identify protective and risk factors in the development of positive and negative health outcomes. Thirdly, we'll understand the importance of early relationships in the development of healthy, active living behaviors. We'll move on to understanding key anticipatory guidance to support early healthy habit formation that aligns with the 521 framework, and how do we tailor that to our earliest children in those initial primary care visits. And then finally, we'll identify key resources to support families in their understanding of responsive feeding practices and the early development of healthy feeding practices. So let's start by talking a little bit about the trends as you see rates. So approximately 17% of youth are affected by overweight and actually are affected by obesity, and that is about 12.5 million children in our country, children and adolescents ages 2 to 19 have obesity. And there is a well-known higher prevalence of obesity in children in minority ethnic and racial groups, as well as among children affected by poverty. And this graph from the National Health and Nutrition Examination Survey from 2015 to 2016 really highlights the prevalence of obesity among youth ages 2 to 19 by sex, race, and ethnic origin. And so you can see that the rate of obesity among non-Hispanic Asian population is at the lowest rate, so at 11%. Next highest is the non-Hispanic white population, and then at 22% is the non-Hispanic black population, and then the highest rates are in the Hispanic population. And that holds true in both boys and girls. So about 1 in 3 children have overweight or obesity before their 5th birthday. And the rate of obesity in children is increasing, especially in the 2 to 5-year-old age category. In 1971, about 4.8% of children in this category were affected by obesity. And then by 2010, 12.4% were affected. And then the most recent data nationwide, about 13.9% of youth in 2013 are affected. Promising data has come out of a study that examined group participants, and they saw declining rates in this age group. And it's thought to be due to the rise of packages as far as what foods were covered, and those took effect was completely rolled out in 2009, but started being implemented in 2007. And additionally, these decreased obesity rates have been introduced in the breastfeeding rates of this population of risk participants. And so if you look at this map, this is risk participants ages 2 to 12 with the 2014 data. You can see Iowa highlighted there in the middle, and our obesity rates are somewhere between 10 and 14.9%. And if you look over here on the right, our obesity rate in our risk population is about 14.7%, and that is in our range about 21st to among the 50 states. And you can see that the rates in 2000 were a little bit lower, and then they continue continue to rise closer to that 15% rate. And then you can see that between 2012 and 2014, there's been a decline in the obesity rates in the population, and that's been true with some of the factors I just discussed. So let's take a minute and drill down to the children affected by severe obesity. So obesity is classified as having a BMI over the 95th percentile. When we talk about severe obesity, we're talking about the 120th percentile of the 95th percentile. So under ethics does have a drop down so you can pull up the expanded, or I think it's expanded BMI chart, so you can see where the children above the 99th percentile are falling, are they above the 120th and 130th or 140th. So severe obesity in this study, published in JAMA in 2018, identified severe obesity as children over the 120th percentile of the 95th percentile. And if you see here at the top, you can see that severe obesity from 2000 to 2014 demonstrated here. And the bottom line, you can see the top line demonstrates the obesity rates in the 4-year-old population, whereas the middle line demonstrates the obesity rates in the 3-year-old population, as well as the bottom line, the 2-year-old population. So you can see that the rates were increasing as we got closer to 2006, and then in the last 2 years, it's kind of leveled off a little bit in the 3 and definitely the 2-year-old population, but the 4-year-old population is leveling off and not necessarily declining. If we look at the second chart here, we're looking at severe obesity, and then the years across the bottom. You can see that the obesity rates in girls and boys are similar. Girls had higher rates of obesity for a while. They evened out and were pretty equal around 2016. And then boys have slightly lower rates of severe obesity than girls now for looking at the 2014 data. And then the final graph on the bottom here is race and ethnicity. And you can see that the Hispanic population is most affected by severe obesity. And then the American Indian and Alaska Native population is next. And then these bottom curves are Asian Pacific, non-Hispanic, Black, and the non-Hispanic white population. So lower rates of severe obesity. So we can see that race and ethnicity do play a role. So what's really important is that children who are diagnosed as having overweight or obesity as preschoolers are actually 5 times as likely as normal weight children to have overweight or obesity as adults. And we're well aware of the severe health complications that can be associated with obesity, in particular with severe obesity. And so we know that by working upstream and helping to identify children most at risk of obesity and putting in place risk implementation or intervention early on, we might be able to prevent things before those obesity rates increase. We know that obesity is a complex and multifaceted condition, and there's a lot of evidence in case for the first 1,000 days as a really vulnerable period for increasing obesity risk. And so many of these slides have been taken from the Institute on Healthy Childhood Weight. They've been working on this building a foundation for healthy active living, and they have a number of modules that I'll talk more about. So the foundations of health for a person's lifestyle and health is really set before adulthood. And we know that during pregnancy, maternal health, and their habits influence prenatal environment of that developing fetus. And it's really a critical period. These factors can include rates of weight gain, diet quality, and level of activity, and that can really affect the developing fetus's health and potential growth trajectory. Additionally, early infancy and early childhood is another important period of time. It's critically important when young children really develop that understanding of hunger and satiety, as well as establishing their food preferences, building motor skills and their capacities, as well as establishing sleep activity and snacking patterns. And so this is a real key period for the development of healthy habits, and that's really influenced by the family environment in which these children are growing up. And so these important windows of time from pregnancy definitely through age 2 and beyond to age 5, are really a unique time to influence the current and future health of children and of their families. And so healthcare providers who interact regularly with families during this key period are in a unique position to really partner and support families in establishing these healthy habits early on. So the American Academy of Pediatrics Institute of Healthy Childhood Weight has been working on building a foundation for healthy active living, and it's an evidence-informed resource that really helps pediatricians and family practitioners and other healthcare providers working with children, as well as public health professionals and other, to improve our patient care and engage families in healthy active living. And they developed a number of really nice educational modules to support clinical care, as well as our anticipatory guidance. They've also developed a consumer-focused multimedia asset panel to increase awareness about key behaviors and support healthy growth and development. And the link to the website is listed there. So that website, that link will pull up this page, and you can see that they have the information about the continuing education and the clinical support, and they have a number of great modules for healthcare providers when you get CME and CEU, CME credit and MLC Part 2 credit as well as this whole other component that's really targeted at families. And so it's great tools that you can promote through your health system or if you're on social media. And so I'll show you some of the different resources there. So here's the continuing education and clinical support. They have a number of different modules, as well as links to behavioral timelines that are really helpful when you're trying to target what anticipatory guidance you'd like to work into your practice. Resources such as Change Talk about how do I have these difficult conversations with family about behavior change, and have some great training on motivational interviewing and how do we nudge families towards change without putting up walls and barriers or introducing or subjecting our families to the stigma. And then they also have great links to the AAP policy statement. So these are the different continuing education modules. So this is a little different than your typical modules, but they have, in each of these different categories, they have mini modules, which are 10 to 15 minutes in length. And so you can really break these up and squeeze them into your day. After reviewing all the modules, then you can see the little online evaluation, and then you're eligible for the MLC Part 2 and CME credit. So it's kind of a different way, and I'm sure at a burst you can get some information in your limited time throughout your day. And then this is the patient education information they have developed. They've done a number of nice infographics as well as some great videos that I'll reference later in our talk. They also have a number of social media assets and additional resources, so I encourage you to check this out. If you're a pediatrician or you're active on social media, I encourage you to share some of this great information out through your avenues to advocate more broadly. So as healthcare providers who deal with children, we usually take a developmental approach to our healthcare visits with children, and when we're dealing with the issue of healthy weight, we can take this developmental perspective as well. And there's a window, as I mentioned earlier, from pregnancy to 5, and that really allows us this opportunity to influence health. And so there's a need for comprehensive, holistic, and longitudinal multi-factor approach. And so there's a lot of that work going on here in Iowa around the 5210 work, which really is engaging multiple sectors. So our early child care, our health care, as well as our schools. Soon there'll be a workplace component, as well as our communities at large. And so there's a need for comprehensive, holistic, longitudinal, multi-sector approach. We also need to acknowledge the role of social determinants of health as we're addressing this issue, is because especially when we're dealing with obesity and healthy active living, it's a really complex situation, and we need to take that social ecological model. I think that they're getting some feedback that that's a little bit muffled. So I'm going to try to pick up the phone line and see if that's easier. I'm hoping that you can hear me a little bit better when I'm talking like this.
Okay, sounds good. So there's opportunities for early intervention in education with coaching or policy change across sectors, and there's as well as with influencers about the healthiest possible environment for our children. And really addressing the factors that we can control during pregnancy to really get those children before birth and those moms and families off to healthy habits even before the birth of the child. There's some key areas where we can intervene during infancy as well as toddlerhood and early childhood. And if we engage the whole family, there's an opportunity to really make and build these healthy habits early on. So let's start by talking a little bit about what factors are important in decreasing the risk of obesity long term. And so appropriate maternal weight gain during pregnancy is important to consider. Additionally, smoke exposure and limiting exposure to secondhand smoke is important as far as decreasing the rates of prematurity. Gestational diabetes and support for moms affected by gestational diabetes and access to nutrition support with dietitians is extremely important to minimize the complications that can result from that condition. Regular exercise during pregnancy is particularly important, as well as a healthy diet. And so it's important to make sure that all pregnant moms have access to quality and sufficient quantities of healthy foods. And then finally, the prenatal care and support with classes such as breastfeeding and parenting classes prenatally play an important role as well. In regard to the perinatal period, it's important that we're doing everything we can to support full-term healthy weight babies being born. And we're supporting moms in that breastfeeding initiation. There's some key interventions that can be put in place in hospitals to increase the success that moms have with breastfeeding and support and access to lactation consultants and support both in the hospital and postpartum as well as support for moms in returning to healthy weight after pregnancy and getting back into their healthy habits after having a baby. And then making sure we're acknowledging the prevalence of maternal depression and making sure we're wrapping support and for mental health care around moms affected by maternal depression is an important role. So the foundations of child health really have three components. And so appropriate nutrition is kind of at the center, and that involves making sure we're supporting key components of breastfeeding as well as responsive bottle feeding for infants. How are we counseling our families on when they're introducing foods? And then how are we supporting families as they're starting to offer snacks and other beverages to their children, and what information are we giving them so that we are ensuring that our patients are having appropriate nutrition and physical activity. In regard to the stable and responsive and nurturing caregiving, this layer kind of refers to parenting and feeding styles, as well as the importance of recognizing hunger and satiety cues in the responsive feeding that's so important, as well as role modeling and starting good family routines around healthy eating and exercise, and having family healthy relationships. And finally, the safe and supportive environment really addresses some of the screen time issues that can come up, the sleep hygiene that's so important for young infants, as well as acknowledging the important role that adverse childhood experiences and how can we increase the resiliency supports that we have for our patients affected by ACEs, as well as addressing food insecurity, as we know that food insecurity does increase the risk of obesity, as it's difficult to access healthy foods at times. So let's move on to the early infancy from that 0 to 6 month period of time. So it's been shown that exclusive breastfeeding, as well as active motor play, and then the maintenance of breastfeeding, as well as appropriate complementary food introduction, all of these things are really important in decreasing the risk of obesity or excessive weight gain in children. full-term and healthy weight infants have lower risks of obesity moving forward. And we know that there's a lot of data to support the recognition of hunger and satiety cues in infants, and this responsive feeding is really important as far as helping infants have a good foundation of recognizing their hunger and satiety. And then safe and responsive bottle feeding, as well as responsive and authoritative parenting. And we'll delve into these a little bit more. So we know responsive parenting, and what is responsive parenting? And it's really defined as an accepting behavior to respond to a children's needs and signals, and it's critically important to young child's development. And infants and toddlers, responsive caregivers really recognize and respond to cues of hunger by responsibly feeding, as well as by cues of sleepiness by establishing good routines. And they respond consistently with consistent soothing responses when they witness distress in their infant, as well as making sure that infant has the opportunity for physical activity. So caregivers' recognition of these cues can have short and long-term positive impacts on the child's health, and caregivers have the ability to build a positive first relationship with an infant, so it's really important. Let's talk a little bit more about the importance of relationships in feeding. And so it's important that there are stable and responsive relationships. And relationships are really at the core of feeding and activity interactions for young children. Responsiveness refers to the responding to the needs of the child and being responsive in our interactions with infants. So the eye contact, the verbalization, and being astute to be able to pick up the cues that young infants are giving us. There are a lot of distractions in our world with phones and screens, and all of those things can hinder our ability to be responsive parents and be responsive to the needs of young infants. And then stability is important as well. It's many children are cared for multiple caregivers throughout the day, and so increasing the consistency between caregivers and the approach that's used by each caregiver is really important when we're trying to wrap that stable and responsive relationship around young infants. So moving on to responsive feeding. So responsive feeding is a component of responsive parenting, and infants and toddlers rely entirely on caregivers to meet their basic needs of feeding. And so why is responsive feeding so important? Is that the caregiver and infants interact a lot through feeding. That's a lot of what infants do to spend their time. And it's their first and most powerful need, and they depend on a responsive adult for this. And so responsive feeding has been associated with really healthy feeding patterns long-term, food acceptance, as well as healthy food habits. And responsive feeding really supports self-regulation. Parents who practice responsive feeding will have children that grow up to have healthier habits. And so if you don't practice responsive feeding, you end up overriding your baby's own internal hunger cues and fullness cues. And your child might develop unhealthy eating habits and be more likely to become overweight or develop obesity later on. You may affect your baby's ability to self-regulate or control his eating and emotions. And responsive feeding is not that you control how much the feeding experience, like you encourage your baby to finish a bottle, even if he's pushing it away and showing you some signs of satiety. It's not that you're being unsupportive or distracted while you're feeding your infant. So minimizing distractions such as not watching your phone or watching TV during feeding time, because you would likely miss some of those cues that infant's giving you. And feeding a baby takes a lot of patience, and it's normal to be frustrated at times, but it's really important to dedicate your time and minimize distractions to create that positive feeding experience. So let's move into anticipatory guidance. So let's start with our 2-week visit. And so when kids are over 2, many of us are using the 5-2-1-0 approach when we're doing our well-child visits for those children ages 2 and above in our clinics. And so we have a standard questionnaire that we'll use at each of the well-child visits. It gives us a great snapshot of where those children are with their healthy habits. But how do we translate that down into this younger population? So if you think about the 5 or the fruits and vegetables component of our message, 5210, it's really important that we're focusing on helping families establish their healthy habits as a family, because we know that children end up eating many times what their family members are eating as they get older. And so how do we help after a family has had a new baby, their world is sometimes turned upside down and their routines are off, and so 2 weeks, they're usually starting to get their feet under them, and so it might be a good time to say, have you had a chance to kind of get into a new routine or get back to any of your healthy habits, and giving parents permission and talking to them a little bit about the importance of making sure that they're getting back to those routines and giving them permission to take the time that they need to get back into those routines is not only important for their health, but also ultimately their young infant's health as they get older. In regard to the screen times, it's important when we're talking about that responsive feeding and responsive parenting that we as parents are really limiting the screen time when we're feeding those infants. And so talking about how important it is to really bond with your infant and try and pick up those cues when you're doing those feedings. And sometimes the screens that are ever present can be a distraction, and just bringing that to their attention. We're talking about exercise. For a 2-weeker, they basically eat, sleep, and hopefully do some tummy time. So that's really their big exercise. So making sure we're educating parents on this opportunity to let that infant start to build up their back and neck muscles with tummy time on a consistent basis. Pardon me. In regard to beverages, encouraging water intake among nursing mothers is really important to establish a good milk supply. And then really focusing on that responsive feeding that we just talked about, talking to our parents about how do I respond to my young child's cues, how do I recognize that satiety and hunger cues. And then being really aware of some key breastfeeding transitions, at which time there are many breastfeeding moms may struggle during certain periods of time. So basically between 2 and 4 weeks of age, sometimes there are issues with concerns about whether or not moms are making enough milk. Sometimes they're having that transition from the hospital and back into home. Sometimes there's a lack of confidence in the breastfeeding skills, or sometimes there's some nipple soreness or pain that's also impacting the ability for moms to nurse. And most times there's a lack of sleep and a tiredness and fatigue and a lot of emotions that can come up between this around this 2-week period, between 1 to 2 weeks and sometimes up to a month. And so being cognizant that this is a critical time and asking moms about how breastfeeding is going, making sure that if they're having any questions, you have qualified staff that can support them. And access to lactation consultants or breastfeeding support groups is an important component in helping support moms through this critical period. The other critical transition comes up before they get to us at their 2-month visit. And sometimes there are psychosocial issues, or moms feel like I was just going to nurse for the first month or so and I'm not going to nurse anymore. And just having some questions about what does nursing longer term look like for me? How can I work that into my schedule? So just having that discussion of how can I support you nursing your infant longer? There's lots of good benefits, and there's lots of support to help continue nursing longer if that's what you choose. And then finally, also making sure we're screening for that maternal depression, as we mentioned before, as well as screening for food insecurity and connecting families to resources such as WIC or SNAP in our communities, or double food bucks, to help them have the nutrition that they need for the parents and the family moving forward. Additionally, it's good to introduce growth charts. There's not a lot of dots on the chart at this young age, but starting to introduce the concept of growth charts. There's usually a lot to cover at this visit, and sometimes parents aren't quite ready to talk a lot about growth charts, but introducing the concept is good at this first visit. So let's talk a little bit more about those hunger and satiety cues. We said responsive feeding is really important. So how do we help give parents some practical tips on how to tune into these cues? And so sometimes parents are often concerned that their baby may not be getting enough. And so giving them some support so that they really are confident in the satiety cues. And there's some great tools that you can offer to your families. And that's really that first step in building that relationship with their infant. So there's some great graphics. These were developed by Women's and Newborn Services in Royal Brisbane Women's Hospital, but they're available online. And they have some great early hunger cues as well as mid-hunger cues and late cues. And you know that if you're nursing in particular, or that once you get to those late cues, a lot of times it can be more difficult and stressful to try and get that child to latch onto that bottle or latch onto the breast. And so helping families recognize and realize that there's some really early hunger cues, and that's kind of the golden time to try and start to initiate those feedings. And how do I try and calm those children during that, once they get to those late cues is really important. This is just another graphic with some of the typical early hunger cues. And it's also important that they not only recognize the hunger cues, but also those satiety cues. And so for children between birth and 6 months, making sure that parents realize that when that child's full, they may push you away or stop sucking, and you extend relax their arms or start to fall asleep, and let them know that it's okay to respond to those cues of fullness, even if they don't necessarily finish that full bottle, that it's important to let the child have some control over the volume of feeds that they get. It's been documented that mothers may appreciate hunger cues much more easily than the satiety cues. And so sometimes issues of overfeeding can come up where we see kids rapidly gaining on that growth chart. And so how do we help cue those families into the satiety cues that are so important? There's a great video that kind of talks about responsive feeding that's located at this YouTube link, so I encourage you to check it out. They're usually about 5 to 7 minutes, so it's a great link that you can pass on to your families, and they do a nice job of talking through some of those responsive feeding cues. So let's move on to the 2-month visit. You know, in regard to the fruits and vegetables, really 2 months is a good time to have a discussion of when to introduce solid foods. There are a number of children that are actually introduced to solid foods well before their 6-month visit. And so it's important to set the stage that really breast milk or formula are really all that children need for nutrition at this young age, and that they don't need to be considering, even though they'll show interest in food closer to 4 months, there's been well-documented studies that to stay at a healthy weight, it's best to wait until they're closer to 6 months. Again, screening for food insecurity and connecting to community resources is important, as well as talking about those family nutrition habits. Have families gotten back into preparing meals at home? What's their schedule like at home? Have they gotten into a routine again? In regard to screen time, also limiting parent screen time not only during feedings, but during tummy time or during interactions. And there's AAP in particular recommends no screen media except for video chatting for parents that are separated by distance until children are 18 months of age. And so many kids are exposed to media at very, very young ages. There's apps for everything out there, and so sometimes there's some infant apps that really aren't necessarily good for children, and so making sure that you're giving those parents that information early on. Again, at 2 months, you want to make sure they're continuing that tummy time and giving infants an opportunity for unrestricted movement. There are many devices that can find children throughout their days, car seats or swings or bouncy seats, exercisers or strollers, and all of these things have diminished the opportunity for children to get physical activity, even at young ages. So important to make sure you're acknowledging that. Additionally, making sure that families are giving themselves permission to take time out to get back into their exercise routines and to encourage families to go on walks together or engage in family activities and get in the habit of that. In regard to beverages, again, it's that responsive feeding we talked about. And then there's another important transition between 3 and 4 months of age. Many times women may be transitioning back to work, and so that's a critical period where sometimes breastfeeding is a little more challenging. So have they explored opportunities to pump at work to be able to continue that breastfeeding during that time period? So having those conversations can sometimes help lengthen the duration of infant feeding. We talked again about screening for maternal depression as well as growth charts. So this is really where you have a little difference between those two dots on the growth chart, and so it's where you can start to talk a little bit more about what that growth chart means. There's a lot of good data that says many parents do not understand growth charts or the percentiles, and so there's some good resources I'll share with you about that. And then finally, sleep hygiene. It's important that infants get between 9 to 12 hours of sleep at night, and then 1 to 4 naps during the day, lasting between 30 minutes and 2 hours. So giving parents some guidelines about the amount of sleep that infants should be getting. We've seen over time that as years have gone by, all of us, including infants, are getting less and less sleep. And we know that this has a big factor in our overall health. There's also some data about that 80% of mothers expect to breastfeed, but by 3 months, that only 41% of mothers are exclusively breastfeeding of those 80% who had indicated that that was their goal. And then by the time infants are 6 months, there's only about 19% of infants that are exclusively breastfed. So you can see that the rates of breastfeeding decrease kind of precipitously. And so if we can recognize these critical transitions, we can sometimes increase the duration of nursing, which we know has long-term health benefits for children. So let's talk about what growth curves we're using. And so it's really important. We know over 2 we use the CDC growth chart, and that shows us the BMI curve. But in children less than 2 years of age, it's recommended that we use the WHO or the World Health Organization growth charts, and we look at the weight for length curves. And we should be watching for acceleration across growth curves on that weight for length percentile. So as I mentioned earlier, that relatively few parents really understand growth charts or the concept of percentile. So taking a little bit of time, particularly at this 2-month visit, is important to be able to set the stage and give them a good understanding moving forward. There's a nice video that was done by the First 5 organization here in Iowa. I know a number of other partners on this, but it's about 7 minutes long, and there's a link to it here. But it really goes through and does a nice job kind of illustrating what are growth charts, and that they don't necessarily have to be at the top of the curve to be doing well, but that they're following their curve. So check that out as well, and I encourage you to share that with your parents. Let's move on to 4 months of age. So in regard to 4 months, we know at 2 months we set the stage that no solids until they're close to 6 months. Again, we can reinforce that. We can make sure the families are starting to develop their meal patterns and getting back to cooking their healthy meals at home. And then discussing that holding off until 6 months is really important, and that you'll kind of talk through what to start when at that visit, or starting to lay the groundwork of what to start with the pureed foods, making sure they're starting with those good fruits and vegetables. In regard to screen time, we're reinforcing, again, no screen media until 18 months, and then limiting that screen time during infant feeding as well as infant playtimes. It's also a good time to kind of introduce screen-free zone concept, that bedtimes, meal times, and child and parent playtimes and locations are really areas that screens should not be on in. And so helping to frame that discussion with parents and start those habits early is a good place to start. In regard to physical activity, again, at 4 months, they're maybe just starting to roll over. That tummy time is really important. Again, limiting the confining equipment. They usually get a little stronger with better head control, so that's at 4 months when you'll start to see kids in bouncy seats or exercisers a little bit more. So we really know that can delay their gross motor skills, and so limiting that time in those confining equipment is important. And then again, reinforcing those family exercise routines is important. Also, back on screen time, I forgot to mention that by 6 months, about 30% of infants are watching TV on a daily basis. So that's at 6 months. So 4 months is a good time to, again, reinforce this media, limiting the media time. And then if we move on to the zero sugary beverages, by 6 months, about 80% of families have already introduced juice into the diet. But even by 4 months, about 20% of infants have already started to be given some juice. And so making sure that we're talking to families about the importance of avoiding juice or sugary, other sugary beverages, and reminding them about the importance of responsive feeding. Kids can get distracted at this age, so it's really important to pay attention to their satiety and their hunger cues. And then supporting parents through that critical transition. Again, sometimes nursing mothers going back to work can have another rocky transition, and so offering additional support can smooth that a little bit and continue to lengthen the duration of breastfeeding. Again, 4 months is a good time to talk about sleep hygiene. Parents understand the amount of sleep that kids need, and then role modeling. So this is a good time. Kids are starting to smile back. They're in general pretty happy, and they're watching everything. So making sure parents are realizing that they really are role models for their children. This is where kids will start to be interested in the food that the parents are eating at mealtime. And so talking about how it's important for parents to be demonstrating that they like fruits and vegetables and making sure they're eating really healthy, because those children are going to want to do exactly what mom and dad are doing. All right, so we moved through the early infancy. Let's move on to late infancy, between 6 and 12 months of age. So some of the important concepts that can decrease the risk of unhealthy weight gain are self-feeding during this point time, as well as the importance of healthy beverages, sleep and meal routines, making sure when we're introducing solids that we're doing a variety of textures and flavors. We're continuing those role modeling and that responsive feeding we talked about. We're setting those screen time limits, as well as maintaining that fruit and veggie consumption. I think you've all probably seen when kids transition off of the purees that sometimes it's a little bit more challenging to prepare the fruits and vegetables to a consistency that kids can handle, but really important to make sure they're still getting all of those good fruits and vegetables. It's more challenging because they're busier and they get places, but making sure they're getting lots of time for active play and limiting that time as challenging as that can be to keep them out of those confining equipment like exercisers and such. So this is a good time, too, about creating a supportive home environment for healthy eating and active living. We know that parents and families together play an important role in creating a healthy nutrition activity environment at home, or what foods are they keeping at home, what habits have they already developed, making sure that it gets a little more challenging with kids between 6 and 12 months. They start to have their own opinions. And so how are we setting appropriate boundaries and attending to and responding to the cues and the behavioral cues, as well as modeling that healthy eating and active living and promoting healthy family interactions at meal times and activities. We know that can be a stressful time. So how do we help set the stage for that challenge and help encourage families to find the positive in meal times, as challenging as they can be? And then prompting specific healthy eating and active living behaviors. So why role modeling and routines? Parents really make a lot of decisions that shape infants and young children's behaviors. Their routines are, children with routines are actually do much better emotionally and socially. And so it's good for a lot of different reasons. And there were 3 household routines that were associated with a reduction in the risk of obesity. And these were eating an even meal as a family, getting the appropriate amount of sleep, and then limiting that screen time to less than 2 hours a day. So there's 3 things we can encourage our families to really focus on. These have really been shown to be impactful from the data side. In regard to the 6-month visit, we want to make sure that when we're introducing solids, we're making sure that we're starting with lots of good fruits and vegetables on the purees, and then when we're transitioning, setting the stage that we'll still need to be doing lots of fruits and vegetables, giving us some easy ideas of what are good first starting fruits and vegetables that can be served safely to children. Making sure we're still being responsive to their cues. And their cues can be a little bit different as they've gotten a little bit older. And then remembering about portion sizes is important as well. And I'll show you a diagram and some good charts, and passing this information on to parents is helpful for them to make those good decisions. And then continuing that family as a role model. In regard to screen time, same thing, really limiting that and introducing those screen-free zones. And then exercise, still important to keep them unrestricted and out of those devices as much as possible, and making sure we're setting that stage and showing kiddos that we as parents are active. And then 0, no juice. This is really important in this age. And introducing water. We know at 6 months it's safe for infants to start to drink water, and so starting to promote that and avoiding that juice. As well as there's another critical transition between 6 and 9 months where sometimes infants will soft wean or moms will have a desire to stop nursing. And so encouraging families, moms, and to know that they don't have to stop completely. They can do a combination. And so making sure that they're aware there are a lot of different opportunities, flexibility, and giving them some extra support with a breastfeeding support group if they're interested that are having some resistance in certain areas. So making sure we're still continuing to offering that breastfeeding support. And then again, sleep hygiene is really important. Again, at 6 months of age, about 30% of the infants are watching TV daily, so remembering that statistic and helping to give that anticipatory guidance to hopefully shift those behaviors. And again, this is at 6 months, about 19% of infants are exclusively breastfed, and so making sure we're continuing to support those breastfeeding moms. And these are the early, the hunger and satiety cues in those older age groups, so making sure parents are aware that they show the hunger cues as well as these satiety cues, and so making sure they're aware of what those are. And so we know that the first 2 years of life are really big transitions in feeding and eating, and by the end of the second year, a lot of food preferences are already well established. And so what happens early on really matters, and so it can have long-term effects on kids, what kids will eventually eat. And so making sure that we're offering those healthy foods in ways, in a positive way, is really important to setting the stage for kids' long-term food preferences. And so there's some great videos, again, on this topic, introducing solid foods. That's an AAP video. So check that one out. It really lets parents know that we have to maybe try up to 15 times before a young child will accept a new food. So we definitely don't want to force it. We want to make it as positive as possible, but if they turn it down 1 or 2 times, maybe even 10 times, it's still important that we're still offering that as time moves on. And so there's also a myth that solid food helps kids sleep longer. There's lots of documentation that it does not. And so making sure we're giving parents that information. Again, that introduction of foods 10 to 15 times seems like we're wasting food, and if they reject it more than once, parents often stop offering. So making sure they're aware of how many times it takes for a child to maybe sometimes accept the food. And sometimes we don't understand the correct portion sizes. And so having some good visual cues and recommendations of what is a proper serving size for an infant really helps set the stage for what is appropriate volume of food for infants to be eating. And again, reminding no juice. So at 9 months of age, we're really focusing on those fruits and veggies at every meal. Again, you're moving off of the purees and onto the solids then, transitioning to table foods, and how do you have a family meal with a 9-month-old? So that can be a challenge and a messy endeavor. So how do we give parents the support that they need to emotionally get through that? Trying to find that positive in those family meals is really important. And then stressing that importance of variety and introduction of foods multiple times, as well as that reminder about the serving size. Again, in screen times, because they're even more aware at 9 months and their vision is better, so no screen media until 18 months, and especially those screen-free zones. They're more aware, so even if there's a background TV on, a lot of times kids will get distracted, and it's been shown that it can decrease their activity level and their responsiveness as well. So important to make sure that that background TV is off as well. By age 1, about 16% of children already have a television in their bedroom, and 38% have been exposed to mobile devices. So really this is another key time period to make sure that kids are starting to use those devices at this age, and encouraging parents to really limit the use of that. Again, reminding, as challenging as it can be with a busy 9-month-old, to make sure that unrestricted movement is really important. That's exercise for kids, and making sure we're giving them lots of opportunities to practice. And in regard to the beverages, by 17% or 17% infants in this age group around 9 months have already been prematurely introduced to cow's milk, and 33% don't drink any water. So really encouraging water intake around this age, making sure we're delaying the offering of milk until after a year of age is important. And then 80% of families by 6 months have introduced juice, so reminding them about the juices. Sometimes you'll even see children getting into soda and fruit drinks, and so you want to make sure you're giving them that good anticipatory guidance that those added sugars are not the healthiest for kiddos. Again, reminding breastfeeding families about that weaning or that maternal cessation transition period, and so giving your families extra support during that time if they do desire to continue to breastfeed. The other thing that comes up is behavior modification at this age. So it's a good time to remind families that it's not a good habit to get into as far as rewarding with food. And then this is a great time to talk about the division of responsibility when we're talking about feeding. So this is an Ellen Satter concept that really talks about how parents are in charge of what, when, and where children eat, and children have the ability and autonomy to decide how much or if. And so helping set the stage that it's just the parent's opportunity or responsibility to offer the food. If the child's hungry, they'll eat it, but they're not a bad parent if their child doesn't eat anything, as long as they're not offering something less healthy later on that then encourages that behavior. So there's some more support around this. And then finally, the role modeling. At 9 months, kids are definitely watching everything we do. And sometimes it's hard with your first child to realize that that baby's watching them that much, but bringing that to parents' attention can be really impactful. And sometimes it's a struggle, too, when you have multiple children. How do I create that routine? And so helping partner with them about some tips to be able to make meal times more positive. Additionally, it may be more difficult in certain situations, and sometimes there's multiple family members that have different ideas about what kids should be eating, grandparents and such, and so involving all family members who are involved in the routine is really important. So we're almost to the end here, but 12 to 15 months, we want to make sure that we're continue to offer that fruit and veggies at every meal. This is a really critical time period. And so there's a considerable drop-off at that 9 months as far as the fruit and veggie consumption. So make sure you're asking about that 12-month visit, what those kids are eating for fruits and vegetables, and asking about the snacks. That's the other thing that comes up at 9 months is the snacking. Encouraging families that fruits, half the plate should be fruits and veggies at each meal, and snacks should contain a fruit or veggie, and really decrease the consumption of that non-nutritive finger food and snack foods that really don't have any nutritional value for kids. Continue to offer that variety, even though they may be refusing it, at 10 to 15 times, and then again talking about that division of responsibility. In regard to screen time, we talked about the rates of TV watching. 39% of families with children around this age have TVs on constantly. And again, we talked earlier that this, this can really affect disrupt their play and their activity level, and can even interfere with their language development and displaces time spent on reading or looking at books. And so really important at this early toddler that we're talking about that background TV and the impact it might be having for children. In regard to exercise, most children under 5 fail to meet the physical activity guidelines. Hard to believe when you're looking at a 1 or 2 year old running around, but sometimes they're not getting that unstructured playtime, so it's recommended at least 30 minutes of structured activity and 60 minutes of unstructured playtime. And encouraging families as time-consuming as it can be when they first start is decreasing that stroller use and increasing the letting those little toddlers walk on their own when they're out and about. Again, in regard to 0, 40% of toddlers consume fruit drinks and 11% consume carbonated beverages on a daily basis at this age. So making sure we're advocating for no juice or fruit drinks. They should be drinking milk with most meals, preferably unflavored and whole milk, and then continuing at breastfeeding if desired. And then sleep hygiene. Toddlers need the 12 to 14 hours of sleep in a 24-hour period, and then remembering not rewarding with food, and then families as a role model in regard to our eating and exercise and screen usage. In regard to the toddler size of portion sizes, these are the different sizes for a quarter cup serving for a toddler, so giving them a good visual about what is the appropriate amount of portion size, and then still allowing them that ability to respond to their internal hunger cues as well, and satiety cues. Two more great videos, the W's of Raising a Healthy Eater, that's about that division of responsibility around feeding, as well as raising a confident eater. So this is talking about the challenges of continuing to offer that variety. So two more really well done videos that have been done in the last few years, so I encourage you to share this with your families, because picky eating is something that many families endure. It can be really challenging. And then some other tips for picky eaters from the AAP, so check out those videos as well. And finally, to finish, we've gotten through we got all the way through our 12 to 15 months, so we're really looking at that early toddlerhood period, and this is getting close to the 5 to 1 0 2-year-old start. So a lot of the same things we've talked about, 18-month the fruits and vegetables, all table foods, picky eaters, serving size, division of responsibility, making sure we're, if they do choose to introduce media at this 18-month period, that it's high-quality programming, that you're limiting the marketing. There's some interesting data on the amount of marketing that children are exposed to and the impact that it has on their eating habits. So making sure that you're limiting that exposure to marketing, you limit that background TV, and then continuing the screen-free zones, in particular in bedrooms, and turning off screens an hour before going to bed. The same exercise recommendations as earlier, and encouraging that walking on outings, and then limiting those fruits and vegetables, and transitioning to that low-fat milk as they get closer to 2 years of age. And then again, making sure that they're getting that good sleep hygiene and we're not rewarding with food. So I just want to finish up in the last couple of minutes about resources. There's not a great snapshot of what kids are doing. There is this family and nutrition and physical activity assessment. This is really targeted for older kids, but it does look at more the family environment. So it's kind of the closest thing we have, but it's another alternative to the opportunity of the Healthy Habits Questionnaire. If you were looking to drill a little bit deeper, everything's looking good on the Healthy Habits Questionnaire, and you wanted to delve into what's going on in the family, this is another option for you. And so the higher the number, the healthier the home environment. So you kind of want a high number on this rating. And it's not that any one cut point is necessarily is the threshold. There's no threshold here. But if you follow this over time, if the numbers get higher, actually the numbers, you want to get a low score on this. I misspoke. So if your numbers are higher, then that increases the risk of obesity as kids get older. And they have done good studies that show that the higher the number, it's related to increased risk of obesity. And then finally, the parent resources that I spoke about, here's the link for those, a lot of those videos and some great infographics as well. This is one example of it. And then there's the link to go to the website to get more information. And finally, the information about the first 5 nutrition series and those videos that I referenced. So please check those out. There's my contact information, and I'd be happy to take any questions in the chat box if you have any questions. Please share any of your feedback. We'd be happy to hear it. Thanks so much. Are there any questions, Becca? All right. We appreciate your time today. Thank you so much. Have a great day.